Bismillahirrahmanirrahim. Today we will have case quiz number 100 and congratulations, we completed 100 quiz in the same week of عيد الفطر المبارك and كل عام وأنتم بخير جميعا. And to the quiz. Case data: 30 years old female, complaining of intermittently occurring joint pain in wrists and ankles, followed by pain in the neck and knee of few weeks, with occasional morning stiffness and tingling sensation in extremities. No headache or constitutional symptoms beyond mild fatigue. Past ANA and rheumatoid factor at the beginning of the condition were negative, but positive family history for rheumatoid arthritis. The patient received ibuprofen with only mild improvement at the beginning of the condition. Examination: mild tenderness at both wrists and mild synovitis in several proximal interphalangeal BIB joints of the hands, including second BIB bilaterally and right third BIB. The rest of exam was non-remarkable. No rashes or skin lesions. Investigations showed ESR is elevated 28 for this age. Rheumatoid factor was 14 in the beginning of the condition, but after a few weeks it raised to 94. ANA by IF is still negative, and CBC showed mild anemia. So, what is the diagnosis? The answer is this case is surprisingly very easy and very straightforward. It is rheumatoid arthritis. We decided to give you a very easy case in the completion of our first 100 case quizzes, and the idea for this very simple case will be shown in the conclusion or the key message at the end of this presentation. Discussion of the diagnosis. Rheumatoid arthritis, or RA, is a chronic inflammatory autoimmune disease of unknown etiology which primarily affects synovial joints. The flagship features of RA is persistent symmetric polyarthritic beginning in the joints of the hands and feet. In general, pathology of the small joints in the hands and feet are the first to be affected by RA. The most common joints involved are the metacarpophalangeal or MCP joints, wrists, proximal interphalangeal or BIB, knee, metatarsophalangeal or MTB, but may also include the shoulder, ankle, cervical spine, hip, elbow, and temporomandibular joints. The acutely affected joints showed inflammation with swelling, tenderness, warmth, and pain with decreased range of motion. So all of the cardinal signs of inflammation should be present, or at least 3 of them. I mean by 3, pain with any other 2 conditions, or pain and swelling may be sufficient to diagnose synovitis. Extra-articular manifestations of RA in the skin, heart, lungs, and eyes can be significant. Additional findings such as atrophy of the interosseous muscles of the hands are seen towards the beginning of the disease process. Deformities such as ulnar deviation, boutonniere, swan neck, and hammer-toe deformities are later manifestations of the disease secondary to repeated joint injury and tendon destruction. The disease usually progresses from the peripheral to more proximal joints and results in significant disability within 10 to 20 years in patients without adequate disease control. Spontaneous remission from RA is uncommon, especially after the first 3 to 6 months. Rheumatoid arthritis classification criteria. In the 2010, the American College of Rheumatology (ACR) and the European League Against Rheumatism (the EULAR) developed an updated classification system for the diagnosis of rheumatoid arthritis. Historically, RA was diagnosed based on the persistence of arthritic symptoms over time, such as in the 1987 old classification criteria of the ACR. However, this classification system failed to identify patients early in the disease course. It is now recognized that very early aggressive therapeutic intervention with disease-modifying anti-rheumatic drugs, DMARDs, significantly improve clinical outcomes, reduce irreversible joint damage and disability, and provides the best opportunity to achieve disease remission. The ideal window of intervention is defined as symptoms duration of less than 12 weeks prior to the initiation of treatment. According to the new criteria, any patient who had at least one joint with definite clinical synovitis in which the synovitis is not better explained by another disease process such as gout, lupus, or psoriatic arthritis should be assessed for rheumatoid arthritis. The new classification system defines 4 categories for diagnosis, as all you know, and towards points based on defined criteria. You know the number of joints, either small or large joint, will score from 0 to 5. The acute phase reactant, ESR or CRB, and the score from 0 to 1. The serology, rheumatoid factor, and anti-CCP score from 0 to 3. And duration of symptoms with a score for 0 to 1. The maximum number of points possible is 10. A classification of definite RA requires at least a score of 6 over 10. But patients who don't reach the threshold for diagnosis or classification but still present a clinical concern can be reassessed over time, and as in this case, you can see that rheumatoid factor, for example, was negative at the beginning but became positive after a few weeks. Now we will jump to the key message of this case quiz. Rheumatoid arthritis should be always the first possibility in any case with definite synovitis not better explained by another diagnosis. Again, rheumatoid arthritis should be always the first possibility in any case with definite synovitis not better explained by another diagnosis, and you should put a very thick red line under the sentence not better explained by another diagnosis. And finally, thank you very much for your attendance, and we will meet you tomorrow with case quiz number 101. Wassalamu alaikum wa rahmatullahi wa barakatuh.